Here are 5 things that I would never do as an integrative gynecologist hormone specialist. Number 1, I would never prescribe oral estrogen. Even if it's oral estrogen and it's estradiol and it's bioidentical, once you take it orally, it increases the sex hormone binding globulin, which actually decreases your testosterone, your free testosterone, and decreases your free thyroid. And let's face it, women at menopause don't need less testosterone. They're all struggling with libido and also don't need less thyroid hormone. They're struggling with their weight as well. Number 2, I would never use birth control pills as hormone replacement. Birth control pills are great for contraception if you need to prevent pregnancy. But if you're trying to replace your hormones and you want something that is similar to what your body's making, birth control pills are synthetic estrogen, synthetic progestins, and the longer you take it, there are risks associated with it. Some small studies actually showed an increased risk of breast cancer. Others showed increased risk of depression. Number 3, and I know I'm going to catch some flack about this, I would never prescribe estrogen only. Whether you have a uterus or not, studies have shown estrogen is a growth hormone. Estrogen causes an increased risk of uterine cancer when you give it alone. There are plenty of studies, including our textbook from Leon Spiroff, that shows that the breast cell and the endometrial cell are the same. So what that means is if you give estrogen to someone, you're causing stimulation of the breast without the balancing hormone progesterone. There are multiple studies that show an increased risk of breast cancer when you give estrogen alone. One of them being the Nurses Health Study, the other one being the E3 EPIC cohort in Europe. Number 4, I would never try to assess anyone's thyroid function just based on a TSH. There are other things in a woman's body and in a men's body that affects the TSH. If your cortisol is too high or too low, it's going to suppress the release of TSH from the pituitary, so you're going to have a falsely low TSH. In addition, there's things that can prevent conversion from T4 to T3. Also, as I mentioned, estrogen, having a lot of estrogen decreases the free thyroid. So you need the whole panel to be able to make an assessment. And number 5, I would never just give someone a prescription without assessing the other things. You've got to sleep 7 to 8 hours a night. You've got to clean up your diet. There's so many endocrine disruptors in the environment, whether it's plastics, whether it's pesticides, whether it's things in our food. Giving someone a prescription without addressing their diet, their stress management, and their movement, they've got to move their bodies, is only going to get you so far.